Hello, this is Dr. Alex Vasquez, and I am posting this brief video in order to introduce you to one of my latest publications. This book is called Integrative Orthopedics for Chiropractic, Naturopathic, and Osteopathic Physicians, subtitled Integrative Nutritional, Botanical, and Manipulative Therapeutics with Concepts, Perspectives, Algorithms, and Protocols for the in-office diagnosis and management of the most common neuromusculoskeletal problems. This is the third edition with new information on laboratory interpretation, iron overload, and fibromyalgia. Stepping beyond the mere diagnosis and treatment of these problems, I've given this book an additional title, which is The Art of Co-Creating Wellness While Effectively Managing Acute and Chronic Musculoskeletal Disorders. This book includes 18 chapters of diagnostics and therapeutics. Those therapeutics include dietary, nutritional, manipulative, and botanical interventions. Also included are clinical pearls, core competencies, and numerous citations to peer-reviewed research. Chapter 1 covers introduction, concepts, patient assessments, musculoskeletal emergencies, and the updated section on laboratory assessment. Chapter 2 is reestablishing the foundation for health. This is a naturopathic concept, consistent with the primary prevention of numerous diseases, as well as the establishment of what's commonly referred to these days as wellness. Chapter 3 reviews comprehensive musculoskeletal care. This includes physical therapies like spinal manipulation, axial manipulation, as well as some soft tissue therapeutics, dietary interventions, and the use of botanical medicines, as well as some miscellaneous physical therapeutics such as rest, ice, and compression that we're all familiar with. Chapter 4 talks about head, skull, and TMJ disorders. Also included in this chapter is a discussion of migraine headaches, also some information as well on cluster headaches and their nutritional and dietary and lifestyle treatments for those conditions. Chapter 5 includes neck and cervical spine, also a subsection on whiplash. Chapter 6 and 7 are thoracic spine, ribs, chest wall, and shoulder, respectively. As you can tell, Chapter 8 and 9 discuss arm, elbow, and forearm, and wrist and hand. Also included in that chapter on the wrist and hand is carpal tunnel syndrome and the differential diagnosis of conditions that affect the wrist and hand. Chapter 10 and 11 are low back pain, lumbar spine, and pelvis and sacroiliac joints. A good discussion here of chronic low back pain and sciatica. Chapter 12 and 13 discuss hip, thigh, and knee. Chapter 14 is leg, ankle, and foot. Chapter 15 discusses iron overload. Iron overload is a hereditary condition considered to be one of the most common hereditary disorders in the Caucasian population, with a heterozygote frequency of about 1 in 200 to 1 in 250. Some studies based on patient populations in hospitals have suggested that the incidence could be much higher in African Americans, perhaps as high as 1 in 80. So we all need to be familiar with the musculoskeletal manifestations of iron overload, its proper assessment, and of course the proper treatment for that. Chapter 16 discusses fibromyalgia, a very common condition. This is an excerpt from a book that I wrote for the Institute for Functional Medicine in 2008 with a few updates to that information, basically discussing the histologic findings, some of the biochemical abnormalities in these patients, and of course the underlying pathophysiology, which is rather easily treated with dietary, nutritional, and occasionally pharmacologic interventions, but certainly diet and botanical medicines are sufficient for most patients. Chapter 17 discusses additional concepts and some selected therapeutics, and we finish with Chapter 18, which reviews core competencies and self-assessments. Numerous multiple choice questions here so that readers can assess their comprehension of the material. What I'd like to do on this final page of this presentation is actually read you the description of the book, so I'll have to read rather quickly in order to get through all of this. But I think this is the best way for you to understand exactly what's included in this textbook, so I will just get started reading. Integrative Orthopedics for Chiropractic, Naturopathic, and Osteopathic Physicians is a clinically oriented textbook that introduces and reviews concepts in the assessment and management of acute and chronic musculoskeletal disorders and injuries. Since approximately 1 of every 7, that's 14% of total visits to primary healthcare provider, is for the treatment of musculoskeletal pain or dysfunction, every physician needs to have, one, knowledge of important concepts related to musculoskeletal medicine, two, the ability to recognize urgent and emergency conditions, three, the ability to competently perform orthopedic examination procedures, and four, the knowledge and ability to design and implement effective treatment plans. Students at chiropractic, naturopathic, and osteopathic and allopathic medical colleges will find orthopedics, integrative orthopedics, to provide a needed blend of concepts as well as the practical how-to information on patient management that is often neglected in other textbooks or which can only be obtained after years of clinical experience. This book will help you synthesize your courses in physical examination, manipulation, physiotherapy, nutrition, botanical medicine, neurology, and therapeutic exercise into a cohesive set of skills that enables you to effectively help your patients overcome their musculoskeletal problems while you simultaneously promote optimal health. There's that word wellness again, by looking at the bigger picture of their overall health rather than simply focusing on the problem. Integrative Orthopedics provides the information and citations to the research literature that you need in order to feel confident about your new skills and new responsibilities that you will face as a licensed healthcare provider. You'll also be able to test your own knowledge and comprehension of the material by taking the final examination that covers the basic material and core competencies that every doctor should know when working with patients with musculoskeletal problems. Physicians and students of all professions will find that Integrative Orthopedics offers the opportunity to review and refresh their knowledge of musculoskeletal medicine and to fill in some of the empty spaces where information has either been forgotten or may not have ever been taught. If your formal education did not provide training in topics such as proprioceptive retraining, interventional nutrition, post-isometric stretching, or botanical medicines, then certainly you'll benefit even more from reading Integrative Orthopedics. Combining Integrative Orthopedics with Integrative Rheumatology will give you a clinical advantage and the research justification to help you treat your patients in the most natural, safe, and holistic means possible. The website provides updates, seminar dates, and recently published peer-reviewed articles by Dr. Vasquez. Dr. Alex Vasquez is a graduate of University of Western States, previously called Western States Chiropractic College, Doctor of Chiropractic, graduation in 1996, Bastyr University, Doctor of Naturopathic Medicine, 1999, University of North Texas Health Science Center, Texas College of Osteopathic Medicine, Doctor of Osteopathic Medicine, 2010. Dr. Vasquez has authored several books, including Integrative Orthopedics, Integrative Rheumatology, Musculoskeletal Pain, Expanded Clinical Strategies, published by the Institute for Functional Medicine in 2008, Chiropractic and Naturopathic Mastery of Common Clinical Disorders in 2009, Integrative Medicine and Functional Medicine for Chronic Hypertension in 2011. More than 90 letters and articles in professional magazines and journals such as The Lancet, BMJ, Annals of Pharmacotherapy, Nutritional Perspectives, JMPT, JAMA, Original Internist, Integrative Medicine, Holistic Primary Care, Alternative Therapies in Health and Medicine, Journal of the American Osteopathic Association, Dynamic Chiropractic, Journal of Clinical Endocrinology and Metabolism, Arthritis and Rheumatism, which is the official journal of the American College of Rheumatology. Dr. Vasquez lectures internationally to healthcare professionals and practices in Oregon. Additional information, updates, and downloadable articles are available at optimalhealthresearch.com. So thank you for your attention during this rather rapid and brief introduction to this new work. There's more information at the website. Again, the website name is optimalhealthresearch.com. Thank you very much, and I wish you the best of health and success.